This morning I want to walk you through this gallery here. I call it catch-all gallery. It has a lot of things of different uses. So I will start with this English around late 18th century. I call it a pharmacy box. I mean, it's almost a complete pharmacy that sat in the buggy of a physician and went to see patients and prepared medicine from this box. It's a rare piece and very, very nicely made. So the first thing I want to show you is you open this door here and you can see the medications in the jars here, and it has a very well-made drawers here. Inside the drawers you can see also more medications, and in some of these drawers you can see the measures for liquid medicine, and even spaces that they need more security, and they have this little sliding cover here. That's to prepare medicine. And this piece has so many different compartments. There's another compartment here which has a scale and more medicine in these bottles. Then you go to the back of this piece, and there's another space that has more of basic medications that can be used to put together for whatever the patient needs. And the nice thing about it is you can, if you forget to lock it manually, there is a small lever here, so when you close it, it locks everything. Now we're going to move to another group of instruments. In this area here, you see, first thing I want to share with you are what we call the invalid feeders. Before the age of IV and the modern medicine, the only way you can get fluids in patients' system will be juices, water, and clear stuff. So these are invalid feeders. There are so many different kinds. And I just want to share with you some ornated ones, such as this one here. I call that this belonged to a rich old lady or rich old man. And there is another one that has the same function, where you put the fluids here, and the patient will suck on the fluids through the spout here. The next thing I want to show you are medicine spoons. There are so many kinds of medicine spoons. This is what I call the portable. The doctor will be moving from one place to the other, and there's a teaspoon here and tablespoon here. As you can see, you can fold it, and it goes in this pouch here, and then be washed just simply with water and used for the next patient. Another type, very, very old medicine spoon. This is made of ivory. This is for medications that are prescribed in small quantities. Another ornated one that reminds me of this feeder here is another medicine spoon. It has this area to sit flat, and again the patient will suck on the medicine here without smelling it because of this area covering it. One interesting thing is this type of spoon. So you put the medicine here, and then you cover the lid here so the patient cannot smell the medicine, and the patient or the child will suck it from here. The curator of the museum here, Ed Zerzak, pointed out to me that what you can do is the mom will blow the air through this, and that will push the medicine to the mouth of a child. I think that's very, very clever way of doing it. The last thing I want to show you in this grouping is a milk bottle. Milk bottles in the 19th century, early 20th century, they didn't have the rubber nipple here. It's all glass. You just put the milk through this opening, cover it, and the child will suck on the milk from this area. Other items in this gallery, we have a nice collection of vaporizers. And I brought this as an example, which is a very beautiful type of construction. And what you see here is the alcohol lamp that will be placed underneath an area here that has the water and whatever medicine you want to evaporate, and the patient will can get the vapor from this area. I believe that they have this thing here under it to collect any dripping so it doesn't go around it. And this came in a box that sits in it to store. It's a wooden box. There is also a nice collection of bedpans. And I want to show you one of them. I mean, bedpans are bedpans, but this is very interesting. And it has this painted area in the bottom. It says, use me well, keep me clean. I will not tell what I have seen. And on the other side, there's a frog that has the color of stool. This is about 1790 type of bedpan. The two handles are usually more rare than the single handle. And they used to ornate it. There's a lot of writing here that I don't know why they put it, but I thought it's very interesting. There are several models that they taught students in the medical school or illustrate to the patients. This is a very elaborate model that's about 1880, 1890, elaborate model of the larynx. It's very accurate being an otolaryngologist, where you see all the muscles here, the muscles that move the vocal cords, and then you can open it and you see inside the larynx. The last thing I want to show you here is an interesting leech jar. So leech used to be used a lot for congestion. As you can see in other galleries, they believe that you need to remove the blood from wherever is congested. Even today, leeches are used with full thickness grafts, you know, that you swing from one area to cover loss of skin. And when they become swollen and start to get blue, they get leech on it to suck the excessive blood and improve the circulation. And to take a leech from the jar to the patient's bedside, they use this little glass container here. They put the leech, one or two here, and they take it to the patient.